Hi, welcome to the ProBalance PT podcast. My name is Ada Wells, and I am the owner of ProBalance Physical Therapy and Pilates. And what I'd like to do is show you how we're going to use this apparatus called the chair. This is called the combo chair, and behind me is the wunda chair. And this is a great piece for when we're doing a lot of work with lower extremity alignment and balance work. We can work on coordination, core control, upper body. You pretty much name it. But I wanted to show you just kind of that progression of how we can do something very basic, say for somebody who's had maybe a lower extremity surgery or has had even some low back issues and needs to learn how to be able to move the lower extremities without moving the entire pelvis and creating more wear and tear there. So kind of starting from the more basic version, there's something we do called the single leg pump. Now I can work on creating alignment down at the lower ankle and foot there. And while I'm doing this, I'm focusing on seeing if I can move this up and down in a smooth manner without doing this with my legs and also without losing my neutral spine. Okay, so I can start with something as simple as this. And once again, this is something that we oftentimes do with people who maybe they've come off of a back injury or some back pain. Maybe they have a sitting job. They need to really learn how to move their bodies and organize their bodies in sitting. So this is a really great way to do it. And we can, do this single leg, do this and add, various variations with the ankle as well. So that might be on the very simple side. We've taken balance completely out of it. Now, if we want to work a little bit more towards some balance, what I can do, we have these handles here so we can hold on, but I can work a little bit on, having the person organize their foot, however they're going to organize it. So maybe I have somebody who's an ankle sprain or somebody who has had a knee injury or, once again, even a back injury, and working on the stepping. So this would be like if I'm going to go upstairs. Now, it's pretty assistive, so I'm getting some assistance from the springs on the way up, but I've got to push on the way down. And I always tell people this is a whole new exercise when you let go because the springs want to drive you up. So you've got to now utilize your control. So this is more working out your brain than your muscles and working how to organize those movement patterns. And we can do this in various positions, including to the side where we're focused on, hey, can we bring the leg out to rotation, which might be something, hey, when do we do this? We do this when we get out of a car, okay? Can you maintain the stability here while this leg is moving and actually create force through it, okay? So these might be our more basic exercises. And then we can actually progress that to something much more challenging. And I oftentimes do this on this particular machine, but I'm going to do it here because you can see me. And that would be doing some of the lunge series. So with this, now I'm not even holding on to anything. I could hold on to those if I was doing it on this chair. But I can work on seeing if I can work on balance and alignment. And now we're really working some strength in the lower body. So me as a therapist or as the Pilates practitioner, I'm watching the knees, I'm watching the pelvis, I'm watching where the ribs are so that I know that the person is really getting this up and down motion from the right places and they're not just muscling through there with momentum, okay? We can do this also, once again, doing the side version that we did here. So on the side. I can actually start to work a little bit on, once again, this is much more challenging with regards to my knee and hip and ankle and foot organization as well as my upper body. And I might stop here and do some things where I'm pumping up and down, which is quite challenging. There we go. Okay, so that gives you a couple of ideas of some of the things we might do to progress somebody for lower body work on this chair. And like I said, the things where we're doing the lunges, those are much more advanced. For some people, just doing the single leg pump here is going to be challenge enough without holding on. For other people, they need more of a challenge. They want to feel that they're getting strength. That's where we start doing that into more of the lunge series. Okay, so hopefully that gives you a little bit more of an idea of the types of things we might do with the chair. All right, we'll see you next time.